Next, via Zoom, we have Leah Vukmir from the National Taxpayers Association. Leah, hopefully we still have you on, and when you speak, you should pop up on the screen, and thank you very much for being here.
Well, thank you. Appreciate this very much, Chairman Vanderwall, Vice Chair Bison, and distinguished members of the Senate Committee on Health Policy and Human Services. My name is Leah Vukmir, and I am the Vice President of State Affairs for the National Taxpayers Union. We are the oldest nonpartisan taxpayer advocacy group in the United States. We are dedicated to taxpayers in the belief that citizens make the best decisions about their money, their own money, and we have consistently advanced policies to lower taxes, streamline government, and to promote free markets. I'm also writing to you from the perspective of a registered nurse and also a former Wisconsin state senator. So hello from across the pond. I urge you to support this crucial telemedicine legislation that I would wholeheartedly support if I were sitting in your shoes. You know, one of the silver linings to the coronavirus pandemic, and we all know that there have been many silver linings, has been the embrace of the healthcare and the embrace of telemedicine innovation to provide Americans with access to healthcare during a time where we saw pervasive lockdowns, fear of leaving one's home. The nationwide movement for telemedicine really played out across the country on a variety of levels. And I believe the success of these policies has resulted in telemedicine evolving from what was simply a temporary necessity to what I believe should be a much needed permanent change. HB 4356 will continue Michigan's leadership in telemedicine. The bill as written is very carefully crafted to ensure patient safety. And as a nurse, obviously that is something that I take very seriously and looked at very carefully in evaluating this legislation. The bill will reduce costs for consumers and ultimately taxpayers. The average cost of an in-person prescription, it has been talked about already in the hearing, could be $185 compared to $40 for an average online screening. You know, at a time when so many people are struggling, they've lost jobs, they've been forced to work fewer hours, this will allow consumers to keep more of their hard-earned dollars and put them towards the important things that they want and need for their families. Consumers in rural areas in particular will also save time and money that is associated with travel to locations far from their homes. Last, but certainly not least, telemedicine can provide potential savings to Michigan taxpayers. State government employees who participate in government-funded health plans could significantly reduce overall costs. And I think, as you know, at a time when states all across the country are grappling with budget constraints, enacting measures that decrease state expenditures is always fiscally prudent. Health and wellness cannot and should not be boiled down to dollars and cents. Still, virtually every discussion of public policy involves to some degree the matter of how consumers, providers, and taxpayers can choose to put resources to their most effective use. This bill gives your constituents the healthcare choices and options they deserve and the freedom to make those decisions as they see fit for themselves and for their families. I really appreciate the opportunity to participate via Zoom. Thank you for accommodating those of us who are not traveling to your state, and I truly hope that you will support HB 4356. Thank you so very much.
Well, thank you very much, Senator. We appreciate you, your testimony, and you know you're welcome to Michigan anytime. So,
well, thank you, and thank you all for your service.
You bet. Any questions from the committee? Seeing no questions from the committee, I do want to say thank you for your service. I see that you served